If general practice is the bedrock of the NHS, which it is, then we need to have a general practice workforce that is able to deal with the changes, and some radical changes have already taken place, and we're in the midst of it.
The main workforce challenge is two really. If I could split it into two sides, there's the training side, and that is actually getting the right jobs for the scheme, so that people do appropriate hospital jobs in their 18 months hospital medicine, which are relevant and are of good enough standard to prepare them to become a general practitioner. The other problem on the training side is just finding sufficient training places in practices. Although we have 550 trainers in my part of the world, we still find it very difficult to find sufficient places for everybody to train.
We need to make general practice more attractive. Why are people not wanting to go into partnerships or even into salaried jobs? A lot of them are settling for doing locums because they don't know the future of their job role.
We're fortunate in the NHS because we have standardised data sets, and these have been put to fantastic use in the construction of this model. So for me, as an expert in human resource management, the opportunity to see a really good piece of workforce planning was great. I really enjoyed it.
I think the NHS as a whole is going through massive reform, and a lot of that's going to fall to primary care with the changes to the way healthcare is commissioned. That, coupled with the changing demographic that primary care is having to manage, so the ageing population and the increased number of long-term conditions that they have, those are the main challenges. And GPs would probably say to you, having to deliver more with less.
I think looking forward, clearly we have a big demographic challenge ahead, and what we're going to need to do is to reconfigure, redesign together a model of general practice which can be as much about health promotion, prevention of disease, as looking after the inevitable increasing burden of long-term conditions.
Delivering primary care isn't all about what GPs can deliver. I think general practice has to be considered as a workforce that delivers the care that's needed by the local population, and that can be delivered. I think nurses have a role to play. They deliver a different part of the healthcare agenda. We know currently that practice nurses deliver 70% of the quality and outcomes framework in general practice. So I think if we're looking at what workforce is needed in the future, we need to focus on who can best deliver that within the funding envelope that's available. And nurses and healthcare assistants have a big part to play in that.
We have to start by seeing how we can change the workload of general practice so that they can be more satisfied with what they're doing and appreciate the outcomes they're delivering, but also in terms of how can we make it better for them to help them deliver some of the outcomes for us from a CCG point of view.